Despite his caring and interesting conversation, I heard very little of it because his large, rosy, bulbous, and bumpy nose had stolen my attention. Years later, when I met him again, he looked like a different man. The rosacea and rhinophyma skin condition, which had made his face so red and nose so massive, was calmed down with medication, and the excessive growth of the skin over the nose had been trimmed away by laser scalpel. This time, my eyes were no longer drawn to that globular and swollen proboscis, and instead I was able to see his kind and wizened eyes. Acne rosacea, or more commonly called just rosacea, affecting 14 million people in the US, or 5% of the population, is sometimes said to be an adult version of acne vulgaris. We see rosacea more often in 30 to 50-year-old women, and it can flare as menopause approaches. When it does affect men, it can be severe. And in a percentage of cases, rosacea can cause an ever-growing piling up of skin over the nose called rhinophyma. Rosacea more often targets fair-skinned, freckle-faced, blonde or red-headed, blue-eyed people who flush easily. It seems triggered by sun exposure, hot drinks, hot baths and showers, hot spicy food, stress, exercise, and steroid medications. Of course, one way to prevent rosacea is to try to avoid such triggers. Acne vulgaris, or more commonly called just acne, is similar to rosacea. Seems also related to hormonal swings, but it affects about 85% of all US adolescents, and more often than rosacea causes whiteheads and blackheads. Adolescents living in Western, modernized societies struggle with acne. However, it affects very few in non-industrialized society. This has led some experts to believe acne, and also rosacea, might be made worse by soap, excessive cleanliness, antibiotic use, and alteration of the normal flora living in our skin that protects us from invasive bacteria, like grass on a lawn protects against weeds. The two conditions of rosacea and acne have common methods of treatment. Over-the-counter lotions like benzoyl peroxide, prescription antibiotics, and vitamin A, both in lotion and pill form, are all still the mainstay of therapy. In contrast, recently there's a trend to move toward supporting one's normal flora, avoiding antibiotics, cleansing agents, or oil-removing methods, and even trying probiotics. This is all in an effort to reestablish a lawn of protection to fight against the invasion of weeds. Well, any of these treatments are effective in most people, but not all. So if you don't find relief with typical treatments, or your nose starts growing, it's time to see the dermatologist.